Today's topic is on endometriosis. We'll tell you all about it and the importance for you to know about it so you can educate your sisters, your mothers, and your wives. And if you're a woman yourself, for you to stay educated. I have with me our regular doctor, Dr. Kelvin Owusu, who's the MD for Optimal Care Diagnostics. Good morning, Doc.
Good morning, Jifa.
Nice to also have with me a very brave woman, Catherine Berkon, who is an advocate for endometriosis as well as the founder of Endo Charity. Good morning.
Morning.
How are you?
I'm blessed, thank you.
Thank you so much for being with
Thanks
us.
for having me.
We haven't seen you in a while.
Yeah.
Maybe 2 years ago, so it's good to have you back.
Thank you.
Doc, let me start with you. What is endometriosis and why should we all know about it?
Well, it's one of the, or should I say, the most common cause of pelvic pain, particularly during your menstruation.
Mm-hmm.
And the name endometriosis originates from the endometrium. Mm-hmm. Basically, the uterus is made up of the layers. When I say uterus, I'm talking about the womb. The womb has different layers of cells. The cells in the innermost part of the womb, where the baby actually stays, that's where we have the endometrium. Mm. So when you have these cells, these endometrial cells, moving from where they are supposed to be to other parts of the pelvis or other parts of the body, then that condition is called endometriosis. Wow. Because even though these cells are not in the womb, they still behave like the endometrium would do if it was in a normal place. Wow. So basically, in simple terms, what that means is that even though the cell has moved from where it is or it's originally supposed to be, during your period, those cells, even though they are now in other places, would still behave as if they were in the womb.
So how does that happen?
Okay, so it wasn't simple enough. So basically, we don't know the cause of endometriosis, mm-hmm. but we have theories as to how it comes about. Okay. The one that the simplest to explain is something called retrograde menstruation. Okay. You know, the womb is like a tube. Mm-hmm. So when you're menstruating, the cells and the blood will come out from the cervix and to the outside. Mm-hmm. When we talk about retrograde, we mean that it's sort of reversed. Wow. So instead of the blood coming out to the outside, mm-hmm. it tends to go back through the fallopian tubes into the pelvis. Mm. Now, this blood also contains cells, the endometrial cells. Yeah. So when this retrograde movement happens, the cells of the endometrium can implant elsewhere. Okay. And because they are cells, they'll begin to grow and develop like they would if they were in the womb. And so when you're having your period, these cells that are outside of the womb also tend to shed. And so you have bleeding in places where they are not supposed to be happening. Mm-hmm. And that is one of the reasons, in fact, that is the reason why there's a lot of pain. Because the new areas where these cells have implanted are not used to experiencing this new thing. And so it causes a lot of pain. In fact, sometimes the pain can be debilitating. Mm. You know, so up to 70% of women who have painful menstruation in the long term actually have, or in retrospect, actually had endometriosis at that point. So it's quite common.
How many of them are even aware that they were going
Most are not aware.
Okay, so this is when I bring Catherine in. Catherine, can you please tell us your personal experience with this topic?
Okay. Mine at the age of 14, the first day I had it was excruciating. Okay. And we would go for trips at Kolibu. Every month I'm admitted at accident and emergency.
What were you feeling?
Because I would vomit a lot. I can't walk. I get paralysis in my legs. Wow. So I'm being held to move around. I had chest pain, I had back pain. There were so many things unexplained, but I think in 1989 then, probably I would say the doctors did not understand because I was misdiagnosed for 11 years.
What?
Before, yeah, and at that time they told me it was in my head. At a point I believed it was in my head.
Why? Because they couldn't understand?
Yeah, because they said the pain I'm describing is not real. You ask me pain level between 1 and 10, and I said I'm at 20. I'm almost passing out with pain. That's the only way I can explain it. And then they said I'm addicted to pain medication. No, I'm in pain. I can't do anything. I can't do any normal activity. So this went on for some time. They'll do x-rays in my chest. We had a lot of scans done, but I was diagnosed with dysmenorrhea, which is painful menses. Okay. And 11 years later, when I traveled, is when I was diagnosed with endometriosis. Even there in London, at accident and emergency, they did not take it seriously when I said menses.
Let me bring Doc in here. What's the difference between dysmenorrhea and endometriosis?
Well, dysmenorrhea simply means, I mean, as she rightly said, it's just painful menses. So dysmenorrhea is not a diagnosis per se. It's a description of what you are going through.
That you are just experiencing
You have painful menses. So you'd have dysmenorrhea as a result of something.
Okay.
You know, so whatever is causing that dysmenorrhea would then be the main diagnosis.
Why would a health professional confuse the two?
No, I don't think it was confusion. They were just describing what she had. So she has dysmenorrhea, and so they are looking. So if you actually come to hospital with a condition, they will say you have dysmenorrhea. Query the cause.
Okay.
So then they would investigate to find out the cause, what is causing the dysmenorrhea. Now, as she described, I mean, in the 80s, this was
90s.
18, yes. So there was not a lot of information. Even she mentioned that even in London, it wasn't taken seriously. So it wasn't a Ghana problem per se.
It's a global issue.
There's a lot of development since then, a lot of advances in investigation since then, and more awareness of this condition. I mean, even from the start, when she mentioned that she was taken to accident and emergency at Kolebu, that means that nobody understood what was going on, because this problem is not handled at that particular department. You know, so there's a lot of new information that is helping to sort of dispel some of the myths in quotes.
But how did you feel
Just
as a young woman?
want to add to what Doctor is saying. It's not that I was asked to go to accident and emergency. It's because I go to my private hospital and they refer me to go to Kolebu.
Wow.
And then during the course of, the pain was there before I had my menses, during my menses, after my menses, I was always in pain. So I hardly had a smile. Like, I was in pain. I didn't understand what was happening, to explain to the next person that this is what I'm going through. So that is how my mom would take me to accident and emergency, because she didn't know what to do when it happened.
So how many days before your period would you feel this pain, and maybe how many days after your period?
Maybe 7 to 8 days, I'll be in pain, chest pain, back pain, bumps, like I'm feeling nausea. It was horrible. Wow. So for me, my point is, if I can tell my story and help somebody going through it now, so they don't get to stage 4. Because when it gets to stage 4, managing it is difficult. Still, some of the things my doctor, it baffles him.
So what stage did you get to?
Stage 4 is the...
You actually got to stage 4?
Yeah, so at the time, they diagnosed me in London. Even then, because my brother-in-law came in and said they should go and check for endometriosis, because his ex-girlfriend had similar symptoms. That is when they wheeled me to the theater. And when they came back, they said I have the severe. They actually asked for them to use my biopsy for research. Because of, and it had covered almost all my organs. So they couldn't do anything about it until I was put in induced menopause. They gave me injections in my tummy to reduce the growth and then to stop the menses. What happens is every time you have your menses, there's a buildup. So they had to stop the menses for 1 year. And then I had this first surgery. So at the moment, I've had 8 surgeries. The last one was last year. And so when we leave it till it's late, managing it becomes expensive and difficult to treat. But when we catch it early, we'll be fine. So there's the need for us to open conversations about it. Because at the point I was paralyzed totally in the left leg. After my first surgery, days after, I was getting some tingly feeling. I told them, this is what I'm feeling. They said, it's normal after surgery, you'll be fine in London. And then 2 weeks later, I couldn't move my leg. So then I have to drag my leg along when I walk. And 3 specialists actually told me I can never use the leg because of the severity of the damage, the tissues in my leg. So it's horrible. It's a horrible thing. Actually, I've met some people who have it in their navel.
Yeah. And
they bleed every time they have their menses in their navel. So it's deformed their navel. There are people that it goes in their chest. There's a lady is in her lung. So every month, blood fills up because it's behaving like
a period.
It's in the uterus. You know, whatever escaped is not meant to be outside the uterus. So then every time you're bleeding down there, wherever the tissue has gotten to bleeds.
So, Doc, how do we spot the signs and symptoms early enough for the women watching and probably are experiencing certain things but taking it for granted?
So that's actually part of the problem. It's not a specific problem you can point to and say, when you see this, it means you have endometriosis.
Okay.
So it's difficult to point to a particular symptom. Then the second issue too is that it's so common. In fact, 10% of women in general will suffer endometriosis at some point. And so because it's so widespread, it's been normalized, and so people don't even bother reporting to hospital with these things. Because I mean, if you tell your friend or your parents that you have painful menses, well, yeah, I also have painful menses, so what? You know, so because of these two factors, it makes it a bit difficult to spot it early enough, you know. But some of the symptoms, as she said, pain is usually the number one symptom. See, but at which point would you say this pain is abnormal pain? That's difficult to define, because pain is subjective. You know, you have to feel the pain and you determine how severe that pain is. So it's difficult to use this person's pain to determine whether she has endometriosis or not. And then the other part too is that the severity of pain is not directly proportional to the severity of endometriosis.
Okay.
You may have very severe endometriosis and have very little pain because of the subjective nature of pain.
So in that case, how would you even know that something is wrong?
So that's what
it's an internal bleeding, so you won't be able to.
So usually the commonest time when endometriosis is diagnosed is when the person is having difficulty achieving pregnancy.
Okay.
That's actually the commonest scenario of diagnosing endometriosis. So the person comes in, I've been married for, let's say, a year or two, I'm trying to get pregnant, it's not happening. Why am I not getting pregnant? Then in the course of the investigation, then they'll discover that, oh, it seems as if you have endometriosis. You know, and then, you know, they'll try and do something about it, including the surgery she mentioned. You know, so that's usually the commonest or the most commonly encountered scenario for diagnosing endometriosis, because this endometriomas or endometrial cells can implant in the fallopian tube, in the ovaries, and can disrupt the reproductive cycle. And so you are trying to achieve pregnancy, it's not happening. You report to hospital, they will do a scan. That's usually the first test that's going to be done. And then they will find something. And even the scan, ultrasound scan, is not going to diagnose the issue. It's going to suggest that, okay, this, and I've seen this and that. Could it be endometriosis? And then you have to go to another level of investigation, which is expensive. And so a lot of women don't do it. And so most of the diagnosis is missed because they can't continue the treatment. MRI is actually one of the a high form of investigation that needs to be done. But the gold standard is what we call laparoscopy. So they would actually go and take you to theater. They are not going to cut you open per se, but they are going to create a small hole and put a camera in there, and then actually visualize the endometrial tissue growing outside of where it's supposed to be. And once you see that, you take a biopsy, like she mentioned, then obviously you know that this is endometriosis. But unfortunately, MRI and laparoscopy are both quite expensive.
What's the price? Because I want us to compare that to the cost of going to get a surgery when you get to stage 3 and stage 4. Because sometimes we take these things for granted, but the cost of actually treating yourself might be way higher than just going to do the MRI.
Well, an MRI could cost anywhere from 1,000 Ghana cedis all the way up to 3,000, 4,000 cedis, depending on how complicated the procedure itself is.
Okay.
And the laparoscopy could be much higher than that.
And how much would be a cost of the surgery? You have a lot of experience.
Okay, so the one before I just had cost me 25,000 Ghana cedis.
Wow.
And it's something that I was sent to emergency. But I thank Leicester Hospital, Dr. Hiaji, because he actually did the procedure before I was asked to pay anything, because he was where I was at that time. He needed to really help me come out of it. So he really sorted me out before but that amount, I mean, I had to go for a loan at some point. My employers helped me at some point. But I mean, this can't continue, because this 25,000 that I paid 2 years ago, or 3 years ago, 2 years ago, I had another surgery last year.
Wow.
Yes. So that's why I'm saying that when we leave it till late, it becomes difficult to manage it, and it becomes expensive, because now contraceptives, if they give it to me, it doesn't work for me. I still will bleed because of the severity of the condition. I have to do injection, which that's the one that puts me into the menopausal state. Then I get hot flashes all the time. I get joint pains. I get nausea. I get dizzy spells. It's a whole lot. So there's the need for us to talk more about it. Currently, it takes 7 to 10 years for a diagnosis to be done. As doctor said, it is only when a woman is married and is trying to have a baby and it's not happening that attention is given.
And then that's
most
maybe
of
too
the
late.
time we are being told it's normal, and I got it a lot. Normal, when I can't walk, I was told it's normal. The nurses kept shouting on me to stop being a big baby, and I mean, all women go through it and all sorts. But I'm saying that I was told I had a low pain threshold, not knowing I had a very high pain threshold. But throughout my life, I was told you have a low pain threshold because your friends go through it and they don't make noise, and you're always crying and crawling around, and I should, it was horrible. It's like you're in a dark space by yourself. Even recently, we have social media. So you can even go on there and find somebody else who has the condition. Imagine 89, if you want to make a call, you have to even go to a comm center to make a phone call, pay phone. So how, you can't get internet on your phone then. So
that
it was
sounds
terrible.
Very, very traumatizing.
Yes, it was.
So how do we ensure that the people who are watching, we're a bit more empathetic to that young girl who is going through this, has no clue what she's experiencing, for us to not belittle the pain that she's going through?
Yeah, I believe menstrual pain hurts. But this kind of pain that I'm describing is excruciating, that you can't do normal activities, taking you out of work or school. If it happens like twice or 3 times, you need to see a specialist. Sure. Mothers, don't tell your children it's normal. It's wrong. Teachers, doctors, please investigate. If we come to you, it's because we are at our wits' end. So please investigate. If you are not familiar with what is going on, kindly refer, because the more we delay, then they become infertile. Another one is the adenomyosis, which is the endometriosis of the uterus. It's in the muscles of the uterus. So when a woman conceives, then the baby gets a miscarriage because of the muscles become weak in the uterus.
How does
and
this
that
happen?
is what Gabriel Union had, and had 9 miscarriages and before. And he has
That's why
also
she had to
always
get
complained about pain when she said she was younger, but no attention was given until she got married and tried to get pregnant. So that is when it was diagnosed.
Doc, how do we ensure that we don't get to a point where it's too late? Like, I'm sitting here now, I have no clue what's going on. I get married a few years from now, and that's when, but I might be at stage 3 or stage 4, and it's a bit late.
So, I mean, I think Catherine has touched on the most important things. Pain, there's a level of pain that's associated with menses, but when you have to miss work, when you can't go about your normal activities, you know, even eating is a problem. You're vomiting all the time. Obviously, there's something else going on, and so you need to, or somebody needs to pay attention to that young lady who is going through that situation, and then take that person to the hospital and the specialist. I mean, the obstetrician gynecologists are the specialists for this particular condition, and so once you are having your mens, because you are having your period almost every month. So you cannot, it's not normal to be missing work every month because you're having your period, you know, and you have women, not all women are missing work. So if you alone, you're having to miss work because you're having your period, then there's something wrong somewhere. And so you need to take responsibility and go to hospital. You see, I mean, yes, on the medical side, admittedly, there's a lot of what's it called? There are a lot of patients. There's overloaded. The hospitals are overloaded, so sometimes they don't pay attention. But you see, if you who is suffering whatever is going on, take it seriously, somebody will pay attention at the end of the day. You see, so if you've gone to a doctor and that doctor is not paying attention to you, switch. It's your right to find a different doctor to attend to you and make sure that you get to the bottom of whatever is going on. Because indeed, endometriosis is treatable. It's manageable. You can actually manage it and achieve, if your aim is to get pregnant, if you manage it, if you catch it early enough and you deal with it, you can actually achieve that pregnancy and you'll be fine to go about your normal work or your normal life activities. You see, and one of the treatments, of course, is hormone replacement, hormone therapy like she went through. And some of the side effects of hormone therapy are the hot flashes, the joint pains,
you really feel like you're going through menopause.
Yes, you actually feel like you're going through menopause.
An elderly person, because they stop the flow of estrogen in your body, because the estrogen is letting it grow.
Exactly.
So it stopped. So
Catherine, you're an advocate for this. We're in a country where people survive on just 5 Ghana cedis a day.
True.
You can imagine how a young girl can even afford some of the tests that Doc has mentioned.
Yeah.
How do we move on from here? What's the progress we need to make?
It's difficult. I've actually reached out to the Women Caucus. I've reached out to a few, because I think they are the people that represent women in Ghana. But I sent so many letters, I followed up, and I'm not. But that aside, I think the doctor I'm working with is really helping quite a number of people because he's treating people. Sometimes they don't have it. Sometimes they have a little. He said, okay, pay what you have because when I let them go, the condition is going to be worse. So what we are doing is trying to get funding for him to be able to help more people. Because it's a private hospital. Definitely,
they
the
have
cost,
to find a way to sustain this.
I can't put my life, I can't put money to my life. So if I'm getting the care there, why not? I would do whatever I can to get better. Because I remember I had to go through so many doctors. And anytime I mentioned menses, they were looking down and writing a painkiller already. They did never listen to me. Straight away, they were writing. And when I go and I complain again, then they give me a stronger medication. And that happened for so long. That was my life. I was on strong medication all the time. So I would say it's difficult, but I know there's hope. There's hope. That's all I can say. There's hope. It's difficult to fund even the test and all that, but so far, Dr. Dixon of Nova Surgery is helping. Is really helping with a lot of patients. So, yeah.
So for viewers watching, corporate institutions watching who may be interested in helping your charity with the work that you do, how do we contact you?
Okay, I'll leave my number.
Okay.
Okay. So my number is 024 9750 561.
Okay.
024 9750 561.
And is there social media handle as well?
Yes, Endo Charity for Facebook, Endo Charity for Instagram, and then Endo Charity for Twitter.
Okay.
Yeah.
Doc, wrap up for us on this topic as far as what we need to know to make this better.
All right, so as I've already said, and as Catherine has already said, early detection is key in dealing with endometriosis. And so if you are going through excruciatingly painful menses, or if you are having your menstruation and it's disrupting your daily activities, you need to get checked up. But let me just chip in that the fact, I mean, you can have normal menstruation for a few years, and then later on in life, you could develop endometriosis. And so if there's been a change in your menstrual cycle or your menstrual attitude, again, you should take note and then report to hospital and have the appropriate investigations done. You know, we can't always say that because of a lack of money we are not going to take care of ourselves, because if it gets complicated, the cost also increases. So it's important that we tackle it as early as possible.
And where do we follow you on social media?
Well, you can find me at Kelvin Owusu MD on all social media channels.
Thank you, Dr. Kelvin and Catherine, for being with us and helping us really understand this problem. I hope that we get to a point where the gender ministry will come and help, and other state agencies as well as private sector people will help, because no young girl or woman deserves to go through this. It's still no fault of theirs. So we have to do better as a country. Thank you both very much. Thank you at home for staying. Don't go anywhere. Breakfast Daily will be right back.